Our next model is the ear. So we begin our exploration of the ear with the outer portion. So this is when people say their ears, this is usually what they're talking about, this outer portion. And this outer portion is correctly known as the auricle or the pinna, which has two main areas. This area that looks like it has a lot of round swirls, we call that the helix. And then down below, this has it cut off a little bit, we have the lobule or the earlobe. Okay? So we have the auricle or pinna itself, the helix portion, right, that has a lot of cartilage to it, and then the earlobe. So this will have hyaline cartilage, and then it transforms slowly down to elastic cartilage that you can test out because you can pull and stretch out your earlobe quite a bit. As we look inside, we see the entrance to the external acoustic meatus, or the external auditory canal. Okay. All right. Now, when we talk about the ear, we usually break it into major structures, but what I want to show you is that most of these structures are going to be cavities inside the temporal bone. So all of this bony area here, that's your temporal bone. So as we begin to look inside at the different structures, remember they're all simply cavities inside the temporal bone once we get past the actual pinna. So I'm going to remove this front portion of our temporal bone so we can see some of these internal structures. So first we're going to start with the external ear. So the external ear will consist of the pinna or the auricle, and then the external acoustic meatus, sometimes called the external auditory canal. And so this is the canal that if you're unwise, you can stick something into. Don't do this, all right? And the external ear is going to end at the tympanic membrane, and especially don't ever touch your tympanic membrane. You'll know if you do, it is exquisitely painful. And the pain is there to help protect you because you don't want to touch it. The tympanic membrane is also known as the eardrum, and that's what vibrates because of sound waves. So sound waves will get captured by the auricle or the pinna. They'll get funneled by the helix into the external acoustic meatus. They will go all the way down and then encounter the eardrum, and they'll send that tympanic membrane into motion. So those are all the structures associated with the external ear.